This video will discuss details about mommy makeover. Mommy makeover is the enhancement of changes related to pregnancy or significant weight loss. Patients who are good candidates for the procedure are women who want to correct their breast deflation and sagginess, and abdomen stretch marks and loss of the six-pack muscle tone. I tailor the surgery based on the changes and goals that you have. In some cases, the shape of the breast can be improved by using implants, a lift, or both. In general, the abdomen needs a tummy tuck to remove the stretch marks. However, liposuction can be of good use to improve contours. My preferred way of doing mommy makeover surgery is under general anesthesia. It usually takes 4 to 6 hours. Patients go home the same day of surgery if the procedure is less than 4 hours, and the usual time off for recovery is 1 to 2 weeks. Some important considerations in preparation for your procedure are the type of implant, either silicone or saline, the implant size, depending on the size that you want to achieve, and the space that your body has to accommodate the implant. The implant shape, either round or anatomical. The implant surface, either smooth or texture. Implant projection, high or ultra-high profile. Implant placement, on top or below the muscle. Incision location, through the axilla, the nipple, or the inframammary fold. Finally, is the breast droopy enough that it will need a lift? Some frequent asked questions that many patients have are silicone implants safe? Yes, the FDA has cleared them since 2006. How long do implants last? Difficult question to answer. The studies report 20% exchange at 10 years. Finally, how long is the time off to recover after surgery? The usual time off after surgery is between 3 days and 1 week. When is an implant needed? It is usually indicated on patients that want to increase breast size. When is a lift needed? Usually this procedure is reserved for patients that are happy with the size but their breast sags from the ideal breast location. Sometimes an implant may improve the overall look to saggy breast, saving you from having more extensive breast lift surgery. However, if the implant does not achieve the adequate correction, a combined procedure, implant and lift, could be combined for a better result. Some frequent asked questions related to the tummy tuck surgery are: would you have drains? Yes, drains are needed to remove excess fluid that collects between the tissues. It usually takes between 1 to 2 weeks for the removal. Would you use a binder after surgery? Yes. Binders will keep the tissues together and it will help with the healing of the tissues. How much weight can I carry? Usually 10 pounds until 6 weeks. Back to normal after that. You can eventually carry your baby if you avoid free weightlifting. Now let's review examples of patients that have undergone this procedure. This patient was in her late 30s. She's a mother of 2 kids. Please note the decreased breast volume and excessive abdominal skin thickness. On this picture, you can appreciate the improved breast fullness and a better defined abdomen with a six-pack look. This patient was in her late 30s. She's a mother of 3 kids. Please notice the droopy look of her breast and the stretch marks on her belly. The picture on the right is a year after her mommy makeover. Notice the improved fullness of her breast and improved contour of her abdomen. Thank you for considering us for your procedure and welcome to our practice. Please contact us by phone, email, or through our website.